have received an invitation again this year from Patsy to present to you all in UL on my work as an educational psychologist in our National Educational Psychological Service, which is NEPS, and that is an agency, a division of the Department of Education. So this morning, I want to give you a flavour of, I suppose, my work in NEPS and give you, I suppose, a sense of the depth and breadth of the work that we do as educational psychologists. I think traditionally there's been a long held view that educational psychologists are involved only in assessment work, perhaps only in dyslexia type work. And I really want to open your eyes to the variety of the work that we do, not just in NEPS, but in other agencies and services as well, and give you a flavour of a day in the life of an educational psychologist or a week in the life of an educational psychologist, give you some information for those of you who are interested in training as educational psychologists, where you can actually do that on the island of Ireland, and some insight into how you can build up your experience with children and young people. I think to work as an educational psychologist, you have to have an interest and a passion for working with children and young people from the outset. But looking at all that lovely experience and interactions that you have with children and young people, and how you can accrue that experience and use it to your advantage when going to apply to train as an educational psychologist, and give you some tips for interview prep as well, and just keeping abreast of all things that are current in psychology, Ireland and internationally. And I suppose we are there's so much available to us now in terms of how we get our information, whether it's podcasts of interest. Traditionally, we would have had to have relied on research journals and access, but I think there's a lot more psychology information available to us. So just to give you a flavour, this poster that I have here on this slide is actually taken from the National Association of School Psychologists in America. And in America, educational psychologists are referred to as school psychologists because if you think of an American type school, they're spread out on very large campuses, and they're lucky enough to have school psychologists based in their school all day, every day. I suppose in an Irish context, and particularly in the Department of Education, I live in Galway, work in our Castlebar office, and I would have a patch of schools in South Mayo, and it is up to me then to provide a service to those schools. So I could be going to very different locations on different days. But in the States, it's a little bit different. And some of my colleagues who work in inner city Dublin, for example, they would have a very small number of schools, perhaps 4, because you can think of the needs are greater in some of our inner city schools than perhaps in some of our more rural schools like here in Mayo. But I do like this poster because it gives us a great overview of the work of school or educational psychologists. And as it says there at the top, we support students' ability to learn and teachers' ability to teach. So when we're thinking of our school as a system in our society, we as educational psychologists, but also with the key adults that we work with in our school systems, our school management, our teachers, our special education staff, our SNAs, we are, I suppose, considered experts, not just in learning, but we have to have an interest in behaviour. Mental health and well-being is a huge part of our work in NEPS at the moment, and a huge emphasis in the Department of Education on supporting teachers and school staff to do as much as they can to support the mental health needs of our students. And everything we do is in this school system. So we provide information and supports. It could be academic, behavioural, mental health. We support teachers in terms of how they evaluate and assess and gather data on their students. We do so much of our work is consultation with teachers and families. So when I say we're moving away from that assessment model of service delivery, we spend a lot of our time meeting with the key adults in the child and young person's life. Our type of schools and the children attending our schools has massively changed even over the last 5-10 years. So we're always trying to work in a culturally responsive way. And I think if you think of NEPS and how or when have you heard of NEPS, you've probably heard it in the media in the aftermath of a very significant or tragic, what we call a critical incident. So a lot of our work is on crisis prevention and a response, supporting the school staff to support their students in the event of a significant critical incident. So we're always looking at supporting struggling and diverse learners. We're interested in achievement and maximizing success for all. And obviously, we want our students to, once they cross that threshold in the morning, to feel that they are in a safe, calm, supportive environment. So being very mindful of the well-being of all. So we want our schools, and we know that once we enter across the threshold of a school, the climate that we're walking into, does it feel safe and does it support all of the needs of all of the students? And we're very interested as educational psychologists in working in partnership with school, family, and community. And we'll touch on that a little bit later on. Who are the people in the community that we liaise with and work very closely with? And everything we do is based on school-wide data-based decision making. So schools, you know, from your own experience of being in primary, post-primary, a lot of what we do, we have standardized assessments, and schools hold a lot of data on students. So we're really trying to support teachers to understand that information and what they can do with it. And sometimes it's not always necessary to have the educational psychologist in to do more assessment when we already know the needs of the student that we've gathered so much data on them. So I suppose, where do EdPsychs work? So I work for NEPS. I suppose we are the biggest employer of educational psychologists in the Republic of Ireland. We would have approximately 240, 250 psychologists, and we're actively recruiting year on year. But we do also work in other health and social care systems, and I would have had experience of working, for example, on a child network disability team before joining NEPS. So that's where we work with teams of children and colleagues, multidisciplinary, supporting children from 0 to 18. I think some people may perhaps don't realise that educational psychologists also work in our child and adolescent mental health service and CAMS. And we also work in our primary care psychology. So when you think of your local primary care building, you would have psychologists, speech and language therapists, OTs, and so on. We also work in a number of voluntary bodies across the Republic. Some of them there you're very familiar with, the likes of Jigsaw, supporting our young people's mental health, Enable Ireland for children with more physical needs, Central Remedial Clinic in Dublin, our Daughters of Charity, our Brothers of Charity. Some of our colleagues work at third level institutions. I know I had a previous trainee here with me last year, and she had worked in Maynooth University as part of their student support team there. Some EdPsychs have stayed in academia and that research piece, which is such a huge part of our work. And some of our colleagues work in private practice. So again, I'm going to talk to you about NEPS, but it is important to know, if you have an interest in working in health and social care or mental health or disability, there are other services there as well, okay? And I suppose when we're thinking about the type of casework that we do, so some of our work is directly with the child or young person. And some of the work is what we call indirect work, and that's with the key adults in the child's life, i.e. their parent, guardian, or a member of the school teaching team or management. And I'll take you through that in a few minutes. A lot of our work is assessment and intervention. So everything we do, we're always talking about the student's response to intervention. And we're also looking at that mental health piece. So when we're talking about building capacity, so if I work in a school, I'm always looking at the support and development work that we can do as educational psychologists. For example, when I would have worked in a disability team, I may have brought parents together to look at how they can communicate with their child, play with their child, toilet training, all those type of support and development needs in a disability. In NEPS, my work is building teacher capacity. So again, that could be supporting teachers to have, I suppose, more knowledge and information about evidence-based practice when it comes to supporting literacy. It could be working with teachers in an autism class around, having a better understanding of autism and the evidence-based approaches that we need to support our young people who are attending an autism class. It could be bringing a group of teachers together at second level to look at how they can develop their student support teams in their schools. So there's great variety. And if you have an interest in a particular area, I know in my work in NEPS, I'm very much supported to roll that work out in my schools. We do a huge amount of systemic work. I mentioned the responding to critical incidents, and that is when you most likely hear about NEPS in the media, and well-being. So we record a lot of videos around good practice in our primary and post-primary schools around well-being. We encourage teachers and schools to self-evaluate. Are they doing enough for their students and young people to support their well-being needs? And again, always encouraging and supporting them to look at new initiatives. It could be around resilience building, anxiety reducing, anti-bullying. So you'll always see that there are lots of initiatives being rolled out by the department in that regard. And then I suppose unique to NEPS and my work in NEPS is that we do get to influence and develop policy within the Department of Education. So we play a huge, and we have a huge influence on the Minister in terms of special education, well-being. We work very closely with our colleagues in the Inspectorate, our colleagues in the HSC, and our colleagues in the National Council for Special Education. So, for example, I would have a particular interest in language and literacy, so I do get to influence the department on that. And again, other colleagues will be involved in critical incident, well-being, social inclusion, supporting our refugee children who are arriving into our direct provision centres. And that leads me on nicely to the final point there, advocacy. So a huge part of our role in schools is around inclusion and supporting cultural diversity, whether it's around language needs, whether it's around a newly arrived child from, for example, Palestine. We did a huge amount to support the young people arriving from Ukraine when the war broke out. So the profile and needs of our schools have changed hugely, and we need to be responsive to that. And even now in my work, I would work a lot with the interpreter services. In my work here in Castlebar, I have a number of children from the direct provision centre here on my caseload. So again, I need to support school staff to support these young people who are experiencing significant trauma and displacement. And again, we work very quickly as a department to get these children into school and get them a school placement, but we know that their home environment is very different to the traditional home environment that we would envisage for most of our children on the island of Ireland. So again, just to give you a sense of the areas in which we complete our casework. So many of you know, as educational psychologists, we're very interested in understanding a child's cognitive profile, excuse me, and their learning needs. We're interested in language and their communication, their social and emotional needs. If we're looking at children who may have an intellectual disability, we're looking at how they function at school and at home, their daily living skills, and also in terms of mental health, anxiety, resilience, those everyday needs that can arise, excuse me, for our young people. Now, again, I touched on that earlier in terms of the methods that we conduct our casework. So again, we consult with the key people in the young person's life. Some of my work can involve observations in the classroom, in the schoolyard. We use standardized assessment tools and questionnaires depending on the area of need that's been identified by the school as a concern. And sometimes we can use non-standardized tools as well. And that might be having conversations with the child and young person, but not using a standardized questionnaire that we'd be familiar with. And then you can see on the right hand of the screen, there are lots of therapeutic approaches that we use and supports in our work. And some of those you're probably familiar with in your psychology undergrad or postgrad in terms of person-centered planning, putting the child and young person to the fore, ensuring the voice of the child and young person in our work. We can be looking at solution-focused brief therapy in our consultations, coming together, bringing people together, and really trying to identify the goals and the targets for this young person. looking at cognitive behavioral therapy. So at a whole class level, we roll out initiatives and really introducing the importance of CBT at a whole class level in terms of introducing the language around how our thoughts and feelings impact our behavior. Some of this work is at individual, some of it's at group, some of it's at a whole class. So just to give you a sense that there's a lot of work involved in our casework with these young people. And another huge part of our work in NEPS is around this support and development. And I touched on it earlier, this building capacity to meet the child's needs. So we may work with our colleagues in TUSLA to support children in care. We encourage schools to roll out a lot of preventative work based on evidence-based programs. Like, for example, if you were to go onto the Department of Education website today, you will see lots of information and programs for schools around anxiety, school reluctance, autism. So we've published a lot of good practice guides for school. We're really interested in supporting language and literacy. We know that's a huge part of the school day is reliant on a child's ability to follow the instructions, to be able to express themselves, to be able to read and express themselves on paper. Even though we're a school-based service, we always meet with parents. And again, no work proceeds without parental consent. A huge part of our work is on that developing trauma-informed schools. We have a number of schools in Ireland that are JESH. We know they are disadvantaged, socioeconomic disadvantage. There are children coming to our schools displaced from war. And again, there are children in our schools in care. So everything we're doing really in our practice in these times is through that trauma-informed lens. We try and support schools around behaviour management. And again, I've touched on that critical incident piece. We are seen as the first responders for school communities when an event has overwhelmed a school community. So you can imagine the sudden death of a student or a tragedy involving a number of students. So that'll give you a sense of the kind of capacity building work that we do, and hopefully giving you a sense of our work is not just limited to assessment, that there are lots of areas. If you think of any school community, there are lots of things that can emerge in an academic year and lots of children with a variety of needs that need support. And again, we don't work on our own, even though I have my own school list and my patch of schools. I very much am at the center of that school community, but you can see there in terms of the systems, I work very closely with my colleagues in the HSC, in CAMS, in TUSLA, in the National Council for Special Education. We talk about our CNOs, our Special Education Needs Organisers. The NCSE also have Teacher Professional Learning Platform, where teachers can raise that they would like an advisor to come to the school to talk about autism or behaviour support. We work very closely with our colleagues in disability. If you think of all the other disciplines like speech and language, occupational therapy, some of our children may be undergoing an assessment of need. So we're very much at the centre of school life. Our schools are embedded in our communities. Our communities, then, we have all these additional services, and we know in some parts of Ireland, some of these are working better than others, but we all have to try and have that collaborative working piece. And I suppose as educational psychologists in a school system, so much of what we do in schools is led by the government. And if we think of our current minister, and we don't know if an election is going to be announced this week or not, but again, so much of, if we think of what's taking place in our schools that is directly coming from the government. For example, in Mayo, we have a counselling pilot that's in its second year in our schools. So teachers, in conjunction with their NEPS psychologists, can put a child forward for counselling. And that is an initiative by Minister Foley. You know, for example, we have our free books for up to junior cycle, I think, at the moment. So again, our schools are very much led by government-led initiatives. And again, all of the schools are such important parts of our communities and societies. So we never work in isolation. We are very much embedded in our community. And I think Really, when we think about educational psychology, it really has evolved as a profession. I qualified in 2011. I did my master's in educational psychology in UCD. At that time, it was a master's program. It has now changed to a doctoral program, but I'll touch on that later on. And definitely, when I did my training, I felt a huge amount of the focus at that time was on the identification of learning needs. And I suppose looking at traditional type assessment work and the identification of dyslexia. But I hope already in our short time together that you get a sense that the profession has evolved and it has had to evolve to meet the needs of our children and young people. And even when you think of COVID-19 and the impact that that has had on our youth mental health, and there's lots of evidence coming out. If we think of our youth mental health lab in UCD, for example, lots of evidence coming out to show that our young people are struggling post-COVID. So again, we've had to evolve, and I think that that is really good in terms of the profession. And again, in terms of an organisation as NEPS, we also recruit and hire counselling psychologists and clinical. And there really isn't a huge difference if you're interested in child and adolescent work. Our profession has hugely evolved. So to give you a sense of NEPS, okay, we have recently reconfigured this summer. We've moved from 8 regions to 6. So you can see, I won't stay too long on this slide, but just to give you a sense, even if you can see your own home county there, or you're all studying in Limerick, you can see there where colleagues in Limerick are aligned in region 4 there, okay? But you could also look at your home county and see if you were interested in the future. And again, our model of service in the organisation, you can see on the left-hand side of the screen, we're looking at our casework, our direct and indirect, and I've given you a flavour of that. And then on the right-hand side, we have our support and development work. And you can see there, that can be advice and consultation. Every September, we sit down with our schools and we plan with them who are their priority needs for the year, whether it's individual students or their own needs as a staff. We look at, is their critical incident plan up to date? And we try and I suppose, advise them to look at what professional learning services do they need themselves. And then we can bring teachers together and cluster them in groups. We sit on our student support teams at post-primary, and sometimes we meet on an individual basis with teachers or a very small group, depending on the complexity of the needs of the child and young person. So casework really does amount to 80% of our work, okay? That's when we really, if we have the indirect where we may be just meeting with the child's parent and school staff to build that capacity that I've mentioned. But the direct work, that's where we sit down with the child and young person for an assessment or for intervention work. And that really is often more complex. If we think of our students maybe in a special class in primary or post-primary, or a child presenting with complex needs around their behavior, and that is more time intense. Whereas the indirect work, when we're doing that kind of consultation work, it is early intervention, preventative work, greater reach, and it's all about that capacity building. And the support and development work that I've touched on, that's about 20% of our work. And I've kind of given you a flavour of that, looking at our critical incidents, bringing groups of teachers together to look at particular groups of children or themes that they feel they want support in. It could be formal teaching, training on our national priorities. And you see there at the bottom of the screen, lots of the initiatives that we roll out in our schools. For example, reluctant school attendance, autism. Our Friends for Life program is our resilience building, anxiety reducing, if you're interested in looking that up. Trauma informed practice. So lots going on in NEPS for sure. Okay. And the ultimate goal of the support and development is around, we have, if we're doing an online webinar, for example, we can have hundreds of teachers on at one time. So again, we're having a greater reach to our schools, and we have to think of the very rural nature of our work, particularly for myself here in the west of Ireland. And you can see there the reach of teachers that we can get in an academic year. It is fantastic. So I suppose if you're thinking about Why would you come to work in NEPS in the future when you're fully qualified? I suppose there is lovely variety in our work. We can work with individuals, we can work with groups, and we can work at that whole systems level. The lovely thing about NEPS is that we're all psychologists working on a team that's quite unique. If you think of all the other services where we work, you are working with SLTs, OTs, pediatricians, for example. There's huge autonomy in our practice. So again, we all have our own unique style, our own unique way of consulting, and our own interests. For example, we have working groups in NEPS. So if you have an interest in trauma, in nurture rooms, in literacy, in workforce planning, you can be part of these working groups. And there's brilliant supervision and support. So we are all obliged to have individual supervision. And we also meet then as groups as well to share practice. We get lots of really valuable CPD. We have national, which is where the whole organization comes together. We have regional CPD, and we also have a budget for our own personal CPD, because obviously it's hugely important as psychologists to keep abreast of new developments, new skills that are needed. And what I really like is that, it is very transparent, our work allocation. We can all go on as a region and look at who's been assigned what school, how many schools they have, and just to be clear and transparent in that not one person is doing over and above what their colleagues may be doing, okay? So I just wanted to give you a sense of a day or a week in the life of an EP. So, for example, today is Tuesday. So last week, as educational psychologists, schools were on their midterm break. We don't get the same holidays as teachers, but obviously when schools are closed, it gives us an opportunity to catch our breath, to avail of peer supervision, to maybe write up some consultation records, to complete some psychology reports, maybe to avail of some CPD, and for some, obviously, we can take our annual leave as well if we want that week. Yesterday, I was out in a school. I have a trainee educational psychologist with me. She'll be with me for this entire academic year. She's come from Mary I, just down the road from you there in UL. And just to let you know that all of our trainees now in educational psychology are fully funded. They get their fees paid and they get a salary. And that is paid for either by NEPS or by the HSC. So, for example, my trainee who's with me, she is fully funded by NEPS, her 3 years of her doctoral program. And she will then come and work with me here in our Castlebar office once she's qualified and gone through the public appointment service and all going well. She will be back to me then to work for 3 years in return for having paid for her training. So that's really, for those of you who weren't aware of that, that is a massive development that came in 3 years ago. And I suppose it puts us on parity with clinical and our counselling colleagues. And I suppose really in terms of if you were worried about how long will it take me to train and qualify, it is hugely reassuring to know that the support is there. So yesterday I was in a school with my trainee. She had requested to get experience in some of our cognitive assessment tools. So we were doing the WISC and our literacy assessment tools. So it was actually a girl, working with a girl in 5th class who'd had lots and lots of targeted evidence-based interventions in literacy. And despite all of the support she received, she just was not responding to intervention. So it was time to come in and do a full assessment with her and meet with parents and meet with the staff and meet with the young person and talk to her about her needs. And we would have called dyslexia. Today, this morning, I had a meeting with my trainee online because tomorrow I'll be observing her completing the assessment in the school with another student. And this afternoon, I'll be meeting colleagues online to plan for our regional meeting next week. Thursday of this week, I'm meeting with a young student who is who's in first year in one of my post-primary schools, but he has been unable to access school since he started at the end of August. So I will be bringing together the key people in his life the young person himself, and then also liaising with our education welfare officer and our local CAMS team to look at the supports to really plan for his return to school. So that'll just give you a flavour in a week. Friday, I will take time to record all the work I've done this week and to ensure that my consultation notes are up to date. And I'll also maybe start one of those reports that I've done this week. But there's lots of opportunity to liaise with colleagues, to liaise with other professionals, and to support a trainee who's starting out in her career. But the great thing about my work is that no week is the same. Next week, I'll actually be going to attend the Psychological Society of Ireland's conference in Athlone. And I would encourage you, any of you who are about to graduate or you have graduated, you're doing a postgrad in UL, to apply for membership of the Psychological Society. I sit on the Division of Educational Psychology's committee and the membership secretary. And I think for any of you embarking on a road in psychology in PSI, we have our early years careers group, and they're a great support. We also have a mentoring program in PSI where you get paired up with a more experienced colleague, and they can share and support with you the type of experience and the type of maybe postgraduate studies to pursue. So I hope that gave you a little sense of the work that we do in NEPS and a little flavour of my week this week and next. So I suppose if you're thinking about, is educational psychology for me? I suppose first and foremost, it is a school-based service. And a lot of what we do, we have to really establish and build good, long-lasting relationships with, for example, the school management team and the teachers on the staff, especially when you work in a rural community like I do. It tends to be the same people in the school for many, many years. There is no requirement to be a qualified primary or a post-primary school teacher to work in NEPS or to train as an educational psychologist. But obviously school-based experience is recommended. But that doesn't have to be just in a teacher role. There are colleagues who would have worked on, they would have worked as special needs assistants, would have supported, for example, summer programs, would have done maybe research endeavours in primary schools. I'll give you a flavour of how I came to train. So I actually worked for many years in a school-based system, but not in this country. I actually worked in Paris and France in an American school system for many years, and then came back to Ireland to do my psychology undergrad. And when I was doing my undergrad in UIG, very fond memories of my 3 years there, I was asked, was I interested in doing a PhD? Now, it's not essential at all to do a master's or a PhD to gain entry into educational psychology. But I had an interest, having worked in a bilingual environment, having worked with children and observing them learning to read and understanding dual languages. I had an interest in pursuing research in that area. So I actually conducted my PhD in language classes and reading classes at primary school level. You may be familiar with them, for students who have significant speech and language delay or literacy difficulties. And then, but that led me then to go to train in UCD, and it was a 2-year master's program. But many of our colleagues here at NEPS, or many of my own colleagues that trained with me in UCD, some were teachers, but others had very much stayed within that psychology route and had very diverse and interesting backgrounds. So once you can establish that you have gained experience, whether it's as you are going to be asked to do a doctoral level training, so you do need to show that you're competent in terms of keeping abreast of research, being a research assistant, or working, for example, like in the Youth Mental Health Lab in UCD, or working as part of in an academic department in one of our third levels. But again, it's all about, as it says there on the screen, working with children, teachers and parents in a non-clinical environment. So we always meet with the children in their school. You have to have an interest in doing that type of casework and obviously applying psychological theories to education. And so much of your undergrad and your postgrad, you have learned naturally about a lot of psychological theories and how they're applied to education. We have to be so considerate of cultural and linguistic diversity in our work. I still continue to conduct literacy research in NEPS. You can see on my PhD, I'm still using that as part of this work. I'm currently involved in the development of a standardized literacy assessment tool for post-primary school students. So it'll be the first Irish normed assessment tool to measure literacy skills for our first years and third years. So our first year tool has been up and running since 2019, and we're currently piloting our third year. And simultaneously, we are this year standardizing a literacy tool for our Oscuelga, for our students who live in Gaeltacht areas and attend Gael Colossi, and that will be ready this September for first years and third years. So you can see how my interest, I still get to use that. And if we're thinking of diversity in our work and cultural responsiveness, I still work on a STAR project. It's called Supporting Traveller and Roma Children. So I have an allocation of time to look at. I have done a research project in a very large school here in North Galway with a significant number of traveller students enrolled, and I supported the staff to look at pre and post literacy assessment tools, looking at the rollout of evidence-based intervention, and really, I suppose, trying, the ultimate aim is to keep these kids in school and that they leave primary school with a certain level of literacy skills, because they've oftentimes been neglected in our education system. And really, I suppose, a huge part of our work is looking at how we can influence the school system and government policy as well. And you can see in my Traveller and Roma work, that work would have influenced I suppose, recent government policy on Traveller and Roma support. So there's lots of opportunities if you are really interested in research. We are considered to be scientist practitioners. So everything we do is informed by research, and there's lots of opportunities to continue that research. So I suppose I've talked now for nearly 40 minutes, and I suppose it's time to tell you about where you can actually train to be an educational psychologist on the island of Ireland. Many of my colleagues would have trained as well in the UK, so there are lots of opportunities there. But I suppose what's really exciting about training on the island of Ireland now is that we have the funded model. As I said, half of the trainees are funded by NEPS and half by the HSC. So I trained in UCD, and I've just got the screenshot there for you of the entry requirements for UCD. You can see there that they ask for, at a minimum, a first or second class honours, minimum a 2-1 degree in psychology or a qualification in psychology that is deemed irrelevant. And you need to be able, obviously, all our courses on the island of Ireland are accredited by the PSI, the Psychological Society. And they do ask in UCD for at least 2 years of professional experience so that really is that piece of, working with children and young people. And I'll get on to that in a minute. Now, I know recently, having talked to this year's cohort of first years in UCD, many did hold a master's. And again, I suppose that's something I would like to raise with UCD in time. Is it a prerequisite to have a master's qualification? Because definitely the majority of their trainees this year do hold, although it doesn't say that in their entry requirements. And you'll be all familiar with the role of assistant psychologists in the HSC. And again, I always think once you bring in a funded model, the entry criteria do get harder. And a lot of the trainees also have or held assistant psychology posts in the HSC. So I would recommend to you all to keep an eye out on when you see those positions advertised. They are a great stepping stone to training. It used to be like that, but definitely once you bring in the funded model. Our other place to train is just beside yourselves. There is an MIC. Again, the same criteria, minimum of a 2-1 and the 2 years full-time experience of working in the field of education or psychology. So again, very similar. the shortlisting is getting harder. And again, it's about showing that you're ready to train. And finally, there is opportunities for people to train in Queen's University in Belfast. They are also funded, but it's not by ourselves in NEPS or the HSC. Obviously, it's by the Education Board up in the north of Ireland. And again, you can go and explore their website there and get a sense of what the course is like. So again, you're probably thinking, well, what is relevant experience with children and young people? So I would encourage you all, especially if you're at your final year of your psychology degree, we do have roles in NEPS for education, well-being / mental health practitioners. So those roles are open to recently qualified graduates in psychology or social care, where you go and you will work in a school, low level intervention work with the support of a senior psychologist in NEPS. So it is a brilliant way to get experience of, in a school system. And it'll be really interesting to see when these practitioners do go on to train as educational psychologists, how they will do in terms of getting a place on the course, because they are really brilliant roles to get embedded in a school doing the intervention work under the supervision. Again, I've mentioned education experience at work in early childhood, special schools, autism classes, special needs assistance, a teacher, anything that shows you have been inside a school, you're interested in working in a school, and you know how a school system operates. I've touched on the assistant psych roles. There seems to be definitely more weight placed on those roles. Anything to do with working at third level colleges, disability offices. I mentioned our previous trainee. She had worked in a disability office in Maynooth for a number of years. And again, what valuable experience to get. Research assistants. There's lots of opportunities for people to gain experience in these roles. And never forget any of the voluntary work you may have already completed to date or you're currently involved in. I've given examples there on the screen like Childline, Barrettstown, and the Samaritans. So again, just giving you a flavour of the prerequisite. And again, when we're thinking about preparing for, so you would only go to apply once obviously you've fulfilled the minimum requirements. But again, even thinking about interview prep, even from now until that point, which may be 2, 3, 4 years away, you will often be asked in these interview processes, because they are doctoral training programs, to review an article and prepare a summary of that article. So again, keeping up those skills, even when you leave university and you are working, to keep up those research skills. How are you keeping yourself informed of skills? Are you continuing to access journals? Are you listening to podcasts? Always thinking about what research have you presented, and any opportunity you get to present, for example, at PSI, our annual student conference, our annual conference, which is taking place next week. I know there's a number of current trainees presenting there next week. Anything that will add to your CV. And always thinking about how are you applying psychology in your current work or your current role when you finish your studies. Everything we do, uh, we follow the PSI code of ethics. So sometimes in an interview, they may ask an ethical question. So again, familiarizing yourself with those code of ethics. And also, because it's a doctorate, you have to be able to demonstrate that you can put a research proposal together. Now, the one that people have to do for their interview does not necessarily mean that they have to stick to that in their research. You can put a proposal together and then change your mind. That's okay, but you need to be able to put one together. And that's why I'm saying it's really important to get involved in these early years careers groups in PSI and mentoring, and knowing that you're able to actually put together a proposal that would warrant a place on a doctoral program. So I've kind of done a whistle stop tour there, and I've given myself 10-15 minutes for questions. I think that's really important part of when I get to do these presentations, is hopefully getting to answer any questions that you might have live here. So I'll hand over to Patsy to see if anything has come in. Now, I